Alright, so we're going to start talking about disorders of integument. You've learned about normal skin, but now we're going to talk about what happens when things go wrong. So we're going to start out with acne. Acne is something that probably every person knows about and everybody experiences at least some of in life. Acne is an infection of the sebaceous gland, which, as you remember, is associated with the hair. But then remember that hair is all over your body, so this can happen, on all of your body. And it's when bacteria gets in there and causes an infection. And there are kind of two different parts. There is two different types of acne. The person in the picture has cystic acne, which is where there is not like a whitehead, to use common terms, and so it's deep within the skin, and it doesn't, there's a lot of pressure there, a lot of redness and inflammation and pain, and generally speaking, that requires some sort of antibiotic to treat. And certainly a trip to, if you have cystic acne, it is something that can be fixed with modern medication and a trip to the dermatologist, and that is definitely in order if you have that. Alright, so skin tags. Skin tags are benign tumors and they're only called tumors because they're like an excess growth. But they are literally what they sound like. Little, tiny tags of skin that grow. They tend to grow on your flank, so like in your armpits more or less, sometimes on your neck. And they can be annoying in that they can get caught on clothes and sort of be aggravated like that, but most people live with them without much affair. You can get them on your pets as well. I have a cat who has a skin tag between his shoulder blades. Dogs can get them as well, and they are pretty harmless for all people unless they get caught on something and torn off, at which point they become ouchy. Alright, vascular birthmarks. Vascular birthmarks are exactly what they sound like. You are born with them, and it affects the capillary beds in the dermis, and they are sort of abnormally open, and it causes raised, puffy areas that are very dark. It is just something that happens in like 0.5% of the population, so a very small percentage of the population, and it is something that it doesn't cause any harm, and nor is it I don't think that there's much that they can do for it either. Alright, dermatitis. Dermatitis, oops, go back. There are a couple different types of dermatitis. Dermatitis is just sort of a generic term for sensitive, dry skin, but sometimes it can be in like flaky patches, and it tends to be dry rather than, not like hives, but like dry skin. And a lot of times you can get dermatitis that contact dermatitis, which is a rash that you get from coming in contact with something that causes irritation. Ooh, nail fungus. Nail fungus is something that you get mostly from, most people don't get it in their fingernails, most people get it in their toenails, and it makes their toenails very thick and grow sort of in a misshapen way. There are oral and sort of paint-on medications that you can use for that, and you get it, generally speaking, from you can get it from a nail salon. People can get it that way. I know I have a sister-in-law who got it that way. Or you can get it from walking barefoot in like a pool area, particularly an indoor pool. It's one of the reasons that there's chlorine everywhere. But again, it's always a good idea to wear shoes when you're in a place like that. Fungal infections. Athlete's foot. Athlete's foot is a fungal infection. Of the feet, it is actually the same fungal infection that causes a overgrowth in the genital region, which I believe is affectionately called jock itch, and the same sort of sprays can be used for that, and also good clean hygiene and keeping on dry socks and dry undergarments and washing those things frequently, so it tends to be a hygiene, something that can be cured with some extra hygiene and some extra washing, and then and an antifungal spray. On the right-hand side of your screen is ringworm. Ringworm does not actually have a worm in it, but it kind of looks like it does, thus the name, and it comes in rings like this. And that is a fungal infection that they're all pretty easily caught between one person and another, so you only need a little bit of this fungus to get an infection. Ringworm is something that you can pass back and forth between animals and people. It's a zoonotic. So I once caught ringworm from a cow. Fun fact. All right, impetigo. Impetigo is a bacterial infection that tends to happen in contact sports and sports where you share equipment that comes close to your skin. It is pretty hard to get rid of, and it is something that is sort of, it's sort of a stubborn bacterial infection, and it's something that will go through, say, like a wrestling team. It tends to be wrestling and a football thing with all, like, the mats and pads and things, and requires, again, a much greater hygiene. Good news about COVID, probably nobody's getting impetigo now. Yes, and sometimes you can get it on your face, and that's horrible. Sometimes you can get it from an infected razor blade, and then you would get it on your face, like, from shaving, and can you imagine? So, always, like, super stubborn, really ouchy, and again, I'm gonna make a caveat for this. If you have a terrible infection on your face, it is the worst, but for some reason someone feels like they must, if you have the world's worst infection, most impetigo does not look like these pictures, but if you have it like this, somehow you're honor bound to put it on the internet. Or if you have it on your genitals, which is also the other reason that, don't Google image search any of these things. You will find more than you bargained for. All right, psoriasis. Psoriasis is chronic inflammation. Sorry that these are hopping in. Somehow I don't know why they do, because I don't like them like that. Psoriasis is a autoimmune disease where your skin builds up extra layers of particularly stratum corneum that are dry, flaky, and itchy. It is an inflammatory autoimmune disorder, and it is also closely related to, like, rheumatoid arthritis, and there's now a new subset of rheumatoid arthritis called rheumatic psoriasis, and so it's an inflammation of joints and the skin. So we're finding that all those inflammatory diseases are sort of close cousins of each other. And it causes these patches of itchy, dry, raised, flaky skin, which you feel like you should just be able to sort of scrub away, but it doesn't work like that. That is not helpful to it, because it is caused by deeper inflammation, and you can see how sort of the dermis is actually itself is growing not just up, but also the epidermis is growing up, also growing down. All right, warts, all different kinds of warts. Awesome. Warts are generally speaking, a herpes virus. Most people get them on their hands or on their knuckles and their knees, particularly as children. It is a virus that passes, and unless it's in a place where this is a plantar wart on the bottom of your foot. Fun thing about a plantar wart is that it is a fungus. It grows deep into your foot. And if you put a piece of duct tape over it, and every time the piece of duct tape falls off, you replace it with another piece of duct tape, it will eventually die. So that's a good treatment that you can use, mostly on your foot, because you can't put a piece of duct tape on your face. However, most warts, they can liquid nitrogen them off. However, most of them, if they're not so big, this is, of course, probably 80% of you have had warts in your lifetime, because it is just a common virus, and that's the only thing that it's just symptoms or little overgrowths of skin. And they just pass, and liquid nitrogening them off is super painful. So probably most of you had them, and then they went away when you had them as small children. But again, this proves the rule that if you have a dime-sized one on your hand, then you put it on the internet, or if you have it on your face, or again, your genitals. All right, boils, and I'm going to put a little trigger warning on boils are gross. So a boil is an infection of the hair follicle that has a little abscess, which is like pus underneath it. So a boil is like a giant pimple. A carbuncle is a bunch of boils that are put together and they're connected underneath the epidermis. So it is like a giant pimple with many heads, and they all, generally speaking, get lanced. If you're into this, there are 1,000 YouTube videos of like Dr. Pimple Popper. That's like her thing. And I will tell you that I watched that once and still can't unsee what I've seen, so just a reminder on that. Okay, and that might be why there are no pictures, because I think that I can't unsee it. So, infections are things like athlete's foot is a fungal infection. Boils and carbuncles are bacterial infections. Also, you could put acne under this. Cold sores, which we generally speaking are associated, and canker sores, which are on the inside of your mouth, cold sores are on the outside of or in the corners of your mouth, are viral. Those cold sores, fun fact, they are viruses that are stored that live forever in your nervous system, so they will come back in times of stress or when you're sick. So other infections, contact dermatitis is an allergic reaction to something that you touched. Impetigo is caused by a bacterial infection. And psoriasis is an autoimmune disease triggered by trauma, infection, or stress. Cold sores, fun fact, impetigo, again on your face. Psoriasis, elbows and wrists are pretty classic psoriasis locations. Impetigo is really just where you get, where you touched, like where you got that infection, and then the cold sores are generally speaking on your mouth. Okay. There is always a section on burns on your exam. So burns are tissue damage caused by heat. Generally speaking, that's what we think of, but you can also get them from you can get an electrical burn. You can get a sunburn, which is actually a real-life burn, or a chemical burn. And besides the wound itself, if you have enough of a burn, you can suffer from dehydration from fluid loss, also electrolyte imbalance from fluid loss, circulatory shock, which is very dangerous. It's essentially when your body's system starts shutting down, and infection because you've broken the barrier of the skin. One of the ways that you determine, so one of the things people will hear about if they have a bad burn is what percentage of their body is affected by the burn. And you use the rule of nines to determine what percentage of your body is burned. So you would go in and say you burned most of your arm, and so if you burned most of your arm and you burned both sides of it, the front is 4.5% and the back is 4.5%. The front of your head is 4.5% and the back of your head is 4.5%. So if you burn your whole head, it's 9%. Whole arms are 9%. The fronts of your legs are 9%. The backs of your legs are 9%. So together they are 18%. Your trunk is 18% on the front and 18% on the back, which makes your perineum, which is your genital area, 1%. So depending on how much of it you burn, that sort of dictates how extensive the burns are, and that's how they are estimated. All right, so you've heard this terminology, I'm sure, but now you'll know what they refer to because you've learned the layers of the skin. So a first-degree burn burns only the epidermis, and it causes a great deal of pain. If you've ever had a burn, you know that they are very painful. The skin will be red and swollen. A second-degree burn has all of the things with the first-degree burn, plus you have blisters. Blisters are like the thing about second-degree burns. So if you have a blister, it's a second-degree burn. And the reason you have a blister is that you've burned the dermis, and so you're collecting tissue fluid from the vascular system because of the vascularization. And so that builds up between the dermis and the epidermis, and that causes the blister. You're not supposed to pop those blisters which also leads to that, like, just the blisters you get on your feet from ill-fitting shoes, that is a friction burn. So that friction caused a burn and a separation between the dermis and the epidermis, and you should not pop them because now you're going to introduce the risk of infection. And then a third-degree burn is going to destroy the entire skin layer, and it will turn black or white. And a lot of times if you have a really bad burn, you'll have all three of them together. Alright, so now you can see all different 3 types of them. You can see a classic sunburn, which is a first-degree burn. It means that there is pain and swelling and redness, but no blisters. However, you can completely get a second-degree burn from a sunburn. Here's a second-degree burn. You can tell because there are blisters. And then there's a third-degree burn where all of the skin is burned away, and you can tell this person had some sort of like shorts on that caused them, or perhaps like boxer briefs that kept them from burning in that location. Alright, so burns are considered critical if 25% of your body has a second-degree burn, and again, you would use the rule of 9s to determine that, or if 10% or more, if 10% or more has third-degree burns, or if you have any third-degree burns on your face, hands, or feet, because those areas are so sensitive, and because you have so many nerve endings that they can send you into shock from the pain. Okay, whole new thing, skin cancer. That was my daughter making a rude noise. Thank you, Miriam, for interjecting. So, skin cancer. Skin cancer is, I lost a friend this week from melanoma, so we'll take this very seriously. It is also a leading cause of cancer death in the U.S., and it is very much preventable, so we'll keep that in mind. So cancer, anytime you have cancer, generically speaking, is an abnormal cell mass. Again, we talked about this when we talked about skin tags. You have benign or encapsulated tumors, meaning that they will not spread. They are just what they are. If they get too big, they can remove them, but they will not have gone anywhere else and affected other parts of your body. Malignant tumors are ones that will metastasize, meaning that they will go to another part of your body, and now you don't have skin cancer alone, you have skin cancer and brain cancer and bone cancer. And skin cancer is the most common type of cancer, so it is something to be concerned with, and again, it is mostly presentable. Okay, so there are different types of skin cancer. The first is basal cell carcinoma. It is the least malignant while still being a cancer, and it is called basal cell carcinoma because it arises from the stratum basal, and again, it is the most common type of cancer, so good to know that the most common type is also the least malignant type. This isn't a great picture of it. It's also a pretty, like, graphic picture of that person's nose, but a basal cell carcinoma can look like this. It is, and I will tell you how to identify skin cancer. It should be removed. If it is removed early enough, it can just be treated. Like, mostly they take them off. Of course, this person's is on their nose, and nose and ears are very important, like, very places that are very susceptible to sun and sunburn. And so people with those types of sunburns often, who've had repeated sun exposure in those areas, noses and ears are places that there's not a lot of leeway to get that part of you taken off. So not good. Our second type is squamous cell carcinoma, and this is arising from your stratum spinosum. And it, generally speaking, is, you'll know you have it. My mother had this kind of a squamous cell carcinoma, and as long as they take it out, and they will take it out, they'll scoop it out, they will take out a lot of tissue around it, as long as they do it soon, you know, early in the after detection, then it is fairly well treated. But they need to. But if you don't treat it right away, it will metastasize to lymph nodes, and then you're getting into a whole nother ball game. A squamous cell carcinoma tends to be flatter, and sort of looks kind of like a scabby, it kind of looks like a weird scabby thing on your skin. I'm sorry that this one has a lot of hair on it, but a squamous cell carcinoma, and it will grow, and you'll know. Like, mostly these things don't stay the same, which is one of the hallmarks. If you have a skin lesion that is changing, you should get it checked out ASAP by a dermatologist, not just like anyone. All right, and our last type is malignant melanoma, and it has malignant right in the name. Bad. And it is a melanoma, lets you know that it is a cancer of the melanocytes. Oops, sorry. And that is bad. The malignant part lets you know that it's bad. Oh, can someone take that away from the dog, please? Thank you. All right, and this is the most deadly type of the skin cancers. It really needs to be identified and treated right away. And generally speaking, you'll have to have other types of treatment as well, radiation or plastic surgery. There's other things that will go with it. And you use the ABCD rule to identify this. All right, so because it's, guys, because it is a cancer of melanocytes, it tends to look like a mole. This does not really look like a mole on this person's toe, but it is definitely like you can see how it's affecting the melanocytes. All right, so the ABCD rule, it's asymmetrical, meaning that both sides are not round together, and they do not have the same color. Like all of these, this goes with the other two. So you can see that. We'll go back, see how it is both lumpy. It is not symmetrical. There are, you know, sort of weird bumps. That also goes with borders. The border is not round and perfect like a benign mole would be. Color, this is 2 colors. And the diameter. So the diameter, the tradition that we say is 6 millimeters, which to Americans means very little, but the size of a pencil eraser is 6 millimeters. So if you could put a pencil eraser on top of it, which clearly this is bigger. So if you know someone who has a mole and it changes, or if you have a mole that appears and then grows, you should have that checked out by a doctor as soon as humanly possible. Because again, your survival rates, I just lost a friend to this, and your survival rates go up exponentially with early detection and treatment. So do in fact do that. All right, that is the end of that. You should go work on your labs, and I will see you next class.